Hello, and thank you for your interest in the Community College of Denver's Practical Nursing Program. This presentation is designed to answer many of the common questions potential applicants have regarding the Practical Nursing Program. Please watch this presentation in its entirety. So, what is an LPN? An LPN is an integral part of the patient's care team, and they work very closely with registered nurses, nurse aides, physicians, physical therapists, nurse practitioners, and all other members of the healthcare team. Practical nurses can work in a variety of settings, including outpatient, inpatient, acute care, long-term care, and home care here in Colorado. The most important thing to understand as a nurse is that you need to have excellent communication and teamwork skills. That is something we'll discuss on the next slide. As a practical nurse, you'll perform a wide variety of skills, often independently. These critical skills include performing patient assessments and therapeutic communication with your patients. You will be administering medications. These may be in an oral, injectable, or intravenous form. You will be providing patient education and delegating tasks to other members of the healthcare team, which may include other LPNs and nursing assistants. You will participate in the care planning of patients. Additionally, you will draw blood for lab work and insert IVs. Lastly, you will insert and maintain urinary catheters, provide wound care, insert nasogastric tubes, assess intake and output, provide tracheostomy care, as well as other sterile procedures.
So, a little information about our program. We are a 35-credit certificate program, after which you will be eligible to sit for the national licensing exam to become a practical nurse. It is important to note that you cannot work as a nurse until you pass this exam. Even if you have passed all of nursing school, you must pass the NCLEX-PN exam in order to work as a nurse. All of our courses occur here at Lowry campus, and they are all in-person classes. You will receive significant support from our faculty and instructors. I promise nobody is more dedicated to your success than our amazing group of instructors. Throughout the course, you will be preparing to take the national licensing exam. We provide education that is innovative, culturally competent, and we prepare nurses that are able to critically think and work independently.
If any of you have friends that are in nursing school or have gone through nursing school, I'm sure you have heard some horror stories. Our program is not unnecessarily cruel, but it is very rigorous, and we have extremely high expectations of our students. We require students who are dedicated, who are lifelong learners, and have excellent time management skills. Even our part-time program option is still very rigorous and requires a lot of extra work outside of the classroom.
Because our program is so rigorous, we offer two options for completing it. Our part-time evening weekend option is a 17-month or 4-semester-long option, starting in the spring semester and ending the following year in May. Classes in this program option are typically held from 5 to 10 o'clock in the evenings, 3 to 4 days a week. Clinical rotations are designed to occur during the weekend. However, again, we are at the mercy of the availability of our clinical partners. Applications for the part-time program are accepted in the prior fall semester, with interviews held in late November. If you are approved to begin the program, orientation is mandatory and is held in December, prior to the January program start. Additionally, we have a full-time day program. This is a 3-semester, 12-month program that starts in the fall and ends after the following summer semester. Classes are typically held during the day, over 4 to 5 times a week. It is very important to note that you should not be working a full-time job while attending the full-time day program. Between the lecture, clinical, lab, and out-of-class studying, you are expected to spend over 40 hours per week dedicated to this program. You are also expected to be available every day of the week as clinicals are scheduled at the availability of our clinical sites. The application period for the full-time program occurs during the prior spring semester, and interviews are held in May. Then, orientation for the full-time program is held in August and is mandatory for all students accepted into the program. Here is the course progression for the part-time evening weekend option. The first semester consists of 10 credits. The second semester consists of 8 credits, followed by 8 and 9 credits for the following semesters, respectively. It is important to note that to be considered full-time, You must take at least 12 credits per semester. Here is an example of the full-time day cohort option. The first semester is 14 credits, followed by 12 credits, followed by 9 credits. The summer semester for the day cohort is condensed into 10 weeks instead of a traditional 15-week semester. This means you will be taking 9 credits worth of learning over a 10-week period. Also, each semester is composed of lecture and lab time, plus 135 hours of required clinical time.
Now, let's talk about the courses you will take in both program options. The very first course you will take is NUR 1003. During this course, you will learn how to perform a head-to-toe assessment. This is the basis for all nursing interventions in nursing. You will learn the difference between normal and abnormal assessment and use assessment equipment such as stethoscopes and pin lights. NUR 1015 introduces the student to the concept of caring for patients who are elderly. NUR 1005 is the second course you will take immediately after NUR 1003. Here you will learn foundational skills in the lecture and lab setting. This includes skills such as inserting a urinary catheter, inserting an IV, administering medication, and all of the hands-on physical skills you will need prior to entering the clinical environment. NUR 1001 is a dosage calculation course. This is required in order to continue in the program. This course does require a high-stakes dosage calculation exam. The student must achieve a 90% in order to pass the class regardless of their final grade. Moving on to other courses, NUR 1010 introduces the student to medications, how those medications work in the body at the cellular level, side effects, therapeutic effects, and what we call contraindications, or reasons to not administer a medication. NUR 1002 is a lecture course where we discuss pathophysiology and nursing interventions to various body systems. NUR 1015 is an introduction to mental health and introduces the student to basic mental health interventions and the concepts of caring for patients in a mental health setting. NUR 1004 is a continuation of NUR 1002, where pathophysiology and nursing interventions get more complex as the disease process and body systems get more complex. NUR 1011 is one of the final courses you will take. You will learn how to take the NCLEX exam and are introduced to concepts such as leadership and professionalism. Finally, NUR 1013 and NUR 1014 are taken consecutively, one after the other, and introduces the student to the concept of caring for patients at the beginning of conception through the teenage years and into adulthood. NUR 1013 encompasses the first half of the semester and cares for the patient up until birth. Then, NUR 1014 runs the other half of the semester and introduces the concepts of caring for a patient from birth to adulthood. It is important to note that each course in this program is a prerequisite for subsequent courses. Failure of one course in this program will prevent you from moving on with the rest of your cohort. Because this is a nursing program, there are mandatory clinical hours required for completion. The PN program at Community College of Denver requires 405 clinical hours throughout the entire course of the program. You will have 3 adult-focused clinical locations that can range from long-term care facilities, acute care hospitals, outpatient clinics, community and home health settings. There is 1 clinical rotation for pediatric and maternal newborn that will typically be done in either an outpatient or home health care setting. The Colorado State Board of Nursing mandates the minimum hours for instruction in all learning environments, including lecture, clinical, and lab. Students are required to attend all lab, simulation, and clinical hours to graduate from the PN program. There is a very strict attendance policy that we enforce here at the PN program, and that is so that all students can meet the minimum hour requirements. Childcare accommodations, work schedule, traffic, weather, and emergency scenarios are not necessarily guaranteed as excused absences from clinical or lab settings. Even in the situation of an excused absence, makeup hours are not guaranteed. If a student does not meet the minimum hours required for the course, they will fail the course. Please note that vacation, work schedule, travel, or domestic issues are not considered excusable reasons for absence and could result in a course failure. Examples of mandatory learning environments here in the PN program at CCD include several styles. There is didactic or classroom instruction to learn theory content. Also, lab instruction environments are required to learn skills related to specific patient populations. The simulation lab is a specific type of instruction. Students can further practice patient care. And finally, the clinical environment. which is the in-hospital or another type of clinical setting used to apply knowledge and skills to real patients. So, if you want to apply to our program, the first thing you're going to do is go to CCD's Practical Nursing website. At that website, specifics on what is required for the application process can be read, but we'll go over them in this presentation. First, if you have not already done so, is you need to apply to CCD as a student and receive an S number and a student email. This is not the same as applying to the PN program. This is a separate application to become a student at Community College of Denver.
Once you have your S number, the next thing is to enroll in the prerequisite courses that are required prior to applying to this program. The requirements are Medical Terminology, or HP, are 1039 and English 1021, which is English Composition 1. You must also complete Math 1120, Math for Clinical Calculations. Students are also required to take Biology 2001 and 2002. These are Basic Anatomy and Physiology, 1 and 2 with lab. Please note that Biology 2001 and 2002 have a prerequisite. You must complete either Biology 1010 or Biology 1111 to be eligible to take 200-level biology courses. All prerequisite courses must be completed with a C grade or above before applying for the practical nursing program. If you have completed any courses outside of the Community College of Denver, including other community colleges in Colorado, you must have an official transcript sent to CCD's Office of Records and Registration. You can easily order transcripts to be sent internally through Parchment for $10. Please visit the CCD Transfer website for complete details. The nursing program cannot move forward with your application until all prerequisites are transferred and have been evaluated by the Community College of Denver's Office of Records and Registration.
After you have taken your prerequisites, or prior to taking your prerequisites, you must register to take the ATIT's exam. The link is provided in this PowerPoint. You must select CC of Denver PN to ensure that we receive the results of your TEAS exam. You must achieve a cumulative minimum score of 58 and a score of 58 in each TEAS test subcategory. It is recommended you take the TEAS test early as you do have the ability to repeat the test 3 times per year, but you must wait 30 days between exams. In other words, if you are applying to take the TEAS test 14 days before the application closes for the PN program, you will be stuck with that score. Please take that into consideration when planning this admission step. Students must also have a valid CPR certificate in order to apply to the PN program. This must be a BLS CPR certification through the American Heart Association. No other forms of CPR certification will be accepted. This is due to requirements from our clinical partners. Additionally, all students must be fully vaccinated. The list of vaccines required are available on our website. Please note you must have had the 2 initial COVID vaccines and an updated yearly flu vaccine. There are no religious exemptions provided through CCD per our community clinical agreements. Proof of vaccination is mandatory to enter any healthcare space as a worker, and it will be a requirement for you as a nurse once you graduate. Vaccination requirements include 2 shots of the measles, mumps, and rubella vaccine, or MMR, 2 shots of the varicella, or chickenpox vaccine, and 3 shots of the hepatitis B vaccine. Additionally, you will need to have had 2 shots of the Pfizer or Moderna COVID vaccines, or the 1 shot of the Johnson & Johnson COVID vaccine with a booster. Additional COVID boosters are not required at this time. However, that may change based on our facility clinical requirements. Flu vaccines are required during every yearly flu season, typically from August to May. For students entering the fall semester, a flu vaccine must be administered during that fall semester, not the previous flu season. The Tdap vaccine, or tetanus diphtheria pertussis vaccine, is valid for 10 years. Please note, we only accept Tdap, not the DTaP vaccine. Also, every year, every student must undergo a tuberculin skin test. This is a 2-step process required by our clinical partners. We do not accept quantiferin tests at this time. Those are the blood tests for tuberculosis. Our clinical partners require the 2-step skin PPD test. If you are an individual who will always test positive for a TB skin test, you must receive a chest X-ray within 4 years to demonstrate you are negative for active tuberculosis. One of the biggest problems students have is obtaining their immunization information, especially if they were born in another country. Our first suggestion is to start with your primary care physician and request a copy of your medical records to see if those vaccines are documented. Discuss with your physician if you've had all of the required vaccines and determine if any are missing. If your physician does not know your medical history, they will draw blood samples called titers. Titers detect antibodies for specific diseases and will let you know whether or not you are immune to a disease. We accept positive titer results as a substitute for vaccine records. If you do not have a primary care physician and do not have medical records, you will need to go into a lab testing site or to a physician. I highly recommend using the health center at your area. They have reduced prices for individuals who are uninsured to ensure that these tests are able to be done and can determine what vaccines you need. Please note any personal records submitted that do not have a medical provider, vaccine name and date, as well as the student's name and date on the record, cannot be accepted. You must have all that information on a valid titer or immunization document. Once you have all the previously mentioned things in your hand, you may apply to the PN program. You must apply with all the forms at once. Partially complete applications will be immediately thrown out without consideration. Please do not start the application process until you have a CCDS number. You have completed the prerequisite courses. You have a copy of your TEAS test results with a score of 58% or higher in each category. And you have individual PDF formatted copies of your immunizations and CPR card. Once again, partial applications will be immediately discarded without consideration. Please have all 5 items ready to upload to the application. Once you have fully applied to the PN program, we conduct a holistic admission process. There will be an interview if you meet the minimum qualifications to enter the program. Please note we are limited by the amount of students we are able to accept in an academic year. Interviews will be offered to the top candidates and are dependent on the number of seats available for that cohort. Once we conduct your interview, we will add your score from the interview to a holistic rubric that takes into consideration the GPA of your prerequisite classes, your TEAS exam score, your written essay score, and any previous education or work experience. Students are then scored in each area and ranked based on total score to determine our admission and wait lists. Please remember, we are limited in the number of students we are able to accept in a given cohort. Because of this, we highly recommend that you work to achieve higher test scores than the minimum required. We also highly recommend that you complete your prerequisites prior to applying. Students who have completed prerequisites will be given higher consideration over students who have their prerequisites in process at the time of their application. To be fully admitted into the PN program, you must also complete a background check and drug screen. We require this background check and drug screen to be completed through Castle Branch Services. The link is listed on this PowerPoint slide. Please use organizational code OZ39 to ensure results are sent to the Community College of Denver. You will need to make sure you keep your own personal copy of your results throughout the entire program. It is your responsibility to maintain your own records, as they may be requested later in the program. We do have a list of disqualifying legal offenses on our website to review. Additionally, it is important to note that while marijuana is legal in the state of Colorado, it is not legal federally and is an absolute disqualifier for clinical placement based on the rules of our clinical partners. Also note that having a medical prescription for marijuana is not an excuse for a marijuana-positive drug screen and will disqualify you from entering the program. You should also contact the CCD Office of Financial Aid to apply for any loans, scholarships, or grants you may qualify for. You can visit their office on the Auraria campus or by calling 303-556-5503. You will need to complete your free application for federal student aid or the FAFSA application to determine your eligibility for any financial assistance. To complete your FAFSA, please visit the FAFSA website listed on the presentation and have your previous year tax returns and your proof of identity ready to upload to the application. Furthermore, to continue to qualify for financial assistance while you're in school, you must remain in satisfactory academic progress. Once you are accepted into the practical nursing program, you will be given a date for a mandatory orientation. This orientation is required for all students accepted into the practical nursing program. Students who do not show up to orientation will forfeit their seat. This orientation will include topics such as a tour of campus, review of handbook and student policies, study tips, preparation for nursing school, and allow you to engage with your peers that you will be learning with over the next 3 to 5 semesters. This slide contains a list of functional abilities required to be a nurse. Please review this and determine if you meet these technical standards. Here is some more information on the policies that apply to all nursing students. We do require natural hair colors and short nails without acrylic overlays. We do allow tattoos as long as they are not offensive, and we allow ear piercings only. Smoking and drug use during nursing school is strictly prohibited, including the use of marijuana. Once again, the COVID vaccine is mandatory for all students in the program based on the requirements of our clinical partners. Some vaccine waivers are site-specific. If you cannot participate in a clinical rotation, you cannot move forward in the program. We do have work restrictions for students who are working and going to nursing school. You must be off of work 8 hours prior to a clinical shift. This means you are not able to work a night shift and then attend a day shift clinical. I want to emphasize that the full-time program is not well suited for students who are working in any full or part-time capacity. This may cause barriers to your success. Building off of that, we do have strict policies on attendance and tardiness that we covered earlier. Missing lab or clinical because of a work schedule is not an excused absence. Once students have completed the PN program, they are not considered nurses yet. Only students who pass the program and take the national PN exam are able to work as a nurse. This is done through the Colorado State Board of Nursing. Our program does everything we can to prepare you to take this national exam. It is highly recommended that you take the national exam as soon as possible after graduating from the PN program at CCD. It can take up to a month or longer for the Board of Nursing to receive your transcripts from CCD. Please start this process as soon as possible after graduation. Students will be given more information on how to complete this step and register for the exam towards the end of the program. Once you take the exam and pass it, you will become a licensed practical nurse. These are some of the areas that our previous graduates are working in now. I do know we have about 4 or 5 prior graduates that are working in inpatient psychiatric facilities. Several of our graduates work in long-term care and home health. One of our graduates is a school nurse for a private school here in Denver, and we have 1 nurse working in hospice. This list is not a comprehensive list of places an LPN can work.
Thank you for watching this presentation. Please feel free to watch again and as many times as needed to gather all of the information. For additional questions about the application process, please reach out to Sarah Luentz, our Interim Director of Nursing Education. Her email address is in this slide. For questions about the program itself, please contact our nursing department at practicalnursing@ccd.edu.